Hello friends, I am Dr. Sadeep. Welcome all to our channel DEMOMEDICO-DIVINE Master. Today friends, I am going to discuss about Aconite. So Aconite is a first medicine we usually study in our course. So this is the acute medicine, as you know. So we will talk about this medicine today friends. So first of all, Aconite in its family origin is Ranunculaceae family. So it is belonging to the Ranunculaceae family, and its common name is monk's hood. So you must be knowing this. Monk's hood is the common name of Aconitum napellus. So Aconitum napellus is a very acute medicine. So miasmatic background is tubercular, that is psoric and syphilitic miasms together forms this miasm, that is tubercular miasm, and the pace of this medicine is very acute. So sudden onset of symptoms, very acute pace is one of the very indicative feature in Aconite. So about pace we have talked, about miasms we have talked, about the causation next we will go into. So causation of this medicine friends is fright, fear, any sort of fear, any sort of fright, any sort of sudden shock, any sort of cold winds affecting the body. Dry cold winds are the main causation of the medicine, and radiating heat of the sun is also a causation of the Aconitum napellus. So another very important cause of this origin of symptoms is type of surgical operations. After post-surgical operations, it is one of the medicines which is indicated. So this is about the causation of the Aconitum napellus. First of all, it is fear, shock, injury, dry cold wind, radiating sun heat. So these are all the causation of the Aconitum napellus. So how the patient presents, what are the symptoms or what are the features of this Aconite? So Aconitum napellus is an acute medicine, as you know, and it is a sudden onset feature it has. And also whenever the patient come up with this acute symptom, sudden onset symptoms of any part of the body, this Aconitum napellus has a tendency to catch these organs, that is lungs. It may come in the form of a cough, cold, pleural effusion, anything like that. Circulatory system, this is one of the very good medicines in angina pectoris and even heart attacks. So this is one of the very good medicines you must think of. And another part of the organ is head, it may be involved, eyes it may be involved, any part of the body it may be involved. But the guiding symptom or the guiding feature of Aconitum napellus is redness. So whichever the part it is affected will become red, and dry heat, dry hotness of the skin will be there in Aconitum napellus. So this is one of the very guiding symptom. And one of the another symptom which we must see into is sweat on uncovered parts. In the covered parts there will be no sweat. In uncovered parts there will be sweat. If you have a keen observation mind and eyes, you can go and look into the patient where the uncovered parts will be sweating, the uncovered parts will be having sweat. So this is one of the very important feature you must look into. And another feature in mental level is fear, fright, fear of death, fear of crowd, fear of going outside. So this is very important in Aconitum napellus. Aconitum napellus is a hot patient. Any sort of heat will aggravate this patient. So in the closed rooms he will be aggravated. In open air he will be more happy and ameliorated. But he can't go outside simply because of his fear, and he has a fear of crossing streets, and he is a very sensitive patient. So that I mean to say that he is sensitive to music, he is sensitive to light, he is sensitive to any of the stimulus. So if the Aconitum patient, if you come across this sensitivity, you must note into, and his fear will be revealed in his eyes. Fear of death, fear of unfortune, fear of uncertainty will be there in him. This fear, mental fear, leads into the restlessness of the body. So any position is not comfortable for him. He will be rotating in the bed. He will not be comfortable with anything is given to him or anything offered to him. His pains will not be relieved by any amount of doing anything to his parts, by massaging, by pressing, by giving heat, by giving cold. Anything you give, the pains are unsupportable. So this is one of the very important features of Aconitum napellus. Aconitum napellus, if you consider any sudden symptom after dry cold winds, so this is one of the important feature you must look into. So Aconitum napellus, as you know, it affects any part of the body, but the features will be the stages of congestion will be appearing. If you go through congestion, this is the first stage of inflammation of the body, wherein the blood capillaries and the blood system become more active. So whenever there is a inflammation in the body tries to overcome that by giving more energy, more supply to that part of the body. So therein the congestion starts happening. In spite of body's support, in spite of body's recovery process, this Aconitum napellus will suffer. Due to that reason, the problem will start in the Aconitum napellus patient and ends in acute fevers, ends in acute heart attacks, ends in acute stages of fever. And one of the important causes of Aconitum napellus, as already I talked, is suppressed sweat. So whenever there is a hot weather, there is a sudden suppression of sweat in the body. This suppression of sweat leading to the fever is one of the very important feature of Aconitum napellus. So Aconitum napellus, as I talked about cause, as I talked about the mental state and the physical state, how it presents in the physical state. The modalities of the Aconitum napellus is, first is the patient is a very hot patient. He cannot tolerate any warmth in his body, and together there will be running of chills. Whenever there is a fever, the patient will be having chills in the warm room. So he want to cover off, but chills will be more. So it is a very a confusing thing for the patient and even for the doctor. But keenly observing doctor must look into the fear of the aconite, so that he can come to the diagnosis of a correct medicine. And Aconitum napellus is unfortunately used in all acute stages and even all types of fever. By a beginning homeopathic practitioner, Aconitum is a first indicated medicine in any type of fever. Unfortunately, we must not use this, and our masters has cautioned us not to use aconite in the first stage of typhoid fever, because it is very much harmful in the typhoid fever if it is used in the first stage of typhoid fever. If it is only indicated, then you can use that. If not, as and when you use aconite in all types of fever, in typhoid fever, it is very much harmful, our masters say. So this is about a short summary of aconite. I will sum up with telling all the features together in it's acute medicine. It has a miasm of tubercular miasm. Causation is fright, fear and suppression of sweat, and dry, cold, hot weather. Sun heat will be one of the causation of factor of aconite, and suppressed sweating, checked perspiration is one of the cause of Aconitum napellus. It is usually indicated medicine in the change of weather, like autumn season, like April to June, like April to May, May to June. These are the 2 months wherein Aconitum napellus has a very strong affinity towards the generation of symptoms. So this is one of the very indicated time of Aconitum napellus. Aconitum will never present slowly, gradually, The pace is very sudden, the pace is very, what to say, like striking. It will rise its symptoms and come down and stops the effect. So this is about Aconite. So Aconitum modalities I already talked. It is a hot patient, ameliorated in cold atmosphere. He wants a little chilly open air. So the time modality is like evening and nights are the very specific time wherein the Aconitum patients will have an aggravation of these all symptoms. Aconitum may affect any part of the body: head, eyes, nose, ears, throat, chest, abdomen, any part of the body. The striking features what I have told, if these features are there, Aconitum is the medicine for the patient, and you can go with a proper indication of this medicine and the patient will be relieved in just minutes. It's not like homeopathy acts, today you give, tomorrow it will act. It's not like that. Homeopathy acts very fastly. Only condition is the pace must be matched, the medicine must be matched, the miasm must be matched. Miasm, pace and the indicated totality of the medicine, if you reach properly, it acts in seconds. I have seen in my practice, the patient will be sitting in front of me. I am giving the pills whatever indicated. He will suddenly tell, what you have given, doctor, because it is implementing on my symptom. What is this magic happening? So the homeopathy is very wonderful magical medicine in the hands of the masters. Unfortunately, the untrained or unskilled people will use it randomly and spoil the name of the homeopathy. It is unfortunately of the system or the great science. So this is all today, friends. How you felt about this session? You just comment in the section, and you send this video to your friends and your colleagues of the homeopathic graduates. So it will be helpful to increase their knowledge to understand Aconite. Thank you one and all. Bye.